think today is another friendly discussion. It is when we meet, it's a family meeting. I bring you greetings from Chief Austin. Chief Austin is the chairman of the Stockton Partnership in Geneva. Is there anybody who doesn't know? You may not know. Yeah. Partnership's advocacy has centered more at the national level. It is the service delivery, which is sputum collection and transportation, that happens at the district level. That is at the NGO. But then the idea with the leadership of public partnership is having this. If we are going to indeed end TB, then we need to begin to decentralize the structures of advocacy. Okay, so what the national chairman is doing with the Minister of Health, with Parliament, with the Office of the President, the committee at the regional level is also going to do the same thing with the Director of Health Services, the Minister of Health at the regional level. Are you getting it?
Yeah.
All the regional officers can also be handled by the regional executives or regional committees.
Yeah.
If you go to the district level, the district committee should be able to engage the district health director, the district chief executive, the district education director, the district mention them, all of them, so that we are on the ground. We are on the ground. If we say, guys, we need to discuss sputum, we need to discuss shortage of TB drugs on radio. If the agenda is set in Accra and we throw it, we know that there are committees at the various regions that can pick it up and begin to do. It makes sense, isn't it? Right at the district level, we know that when the regional executives speak it, they can throw it at the various people who are in the region and say, we are monitoring you. That radio station, go there, that place. Even if it's community information centers, somebody is talking, we can take over the space and make TV very visible and feasible. When it becomes visibly feasible, then we are going to get more resources.
So the Challenge Facility for Civil Society is an initiative by Stop TB Partnership. So Stop TB Partnership is the global organization that is championing TB initiatives across the world, and their headquarters is in Geneva, in Switzerland. So it's an initiative by Stop TB Partnership, particularly towards the protection of the rights and privileges of persons living with and affected by TB. So Challenge Facility for Civil Society is a project or a grant that is given to community-based organizations across the world to champion the initiative, which is the protection of the rights of persons living with and affected by TB. If you have taken a look at the End TB strategy by WHO, the protection of the rights of persons living with and affected by TB is a key component of that strategy. So the journey towards ending TB by 2030, key among, one part of the journey is protecting the rights of persons living with and affected by TB. So the first on the list of project objectives is to establish sustainable TB advocacy committees at the regional and district levels by March 2024. So I guess we are all starting to understand why we are here today. Sure. One of the objectives of the project is to establish regional and district level committees that are going to champion the cause of the project at these various levels. So we are expecting that as regional advocacy committees, you are going to keep your eyes on the ground. If there are any issues surrounding TB, is someone not getting access? Please, I'm going to share the presentation so you can put your phones down. Is someone not getting access to their medication? Is someone not going to the hospital to get their medication because the nurse or the doctor treated them badly and hence they don't feel this will go for the medication? Is someone not being able to take their medication because they can't afford 3 square meals a day? These are some of the issues that we expect you, the regional advocacy committees, to address. So The next objective, to build the capacity of 112 regional and 200 district committee members to promote community-led, rights-based, gender transformative and accountable TV response in Ghana by March 2024. The reason you keep seeing by March 2024 is that that is the time that we are expecting the Round 11 project to come to an end. Please, is it clear? That's why you keep seeing March 2024. So I think the second objective is quite clear. That is what we are still doing right now. So we sent out a call for expression of interest. You applied, you were selected, and now we need to build your capacity to be able to know and understand what is expected of you, how you are going to be doing what you are supposed to do, and what you are supposed to use to do what you are supposed to do, and what you are supposed to achieve by the end of the project. So the capacity building is what we are doing right now. We have, I think, a 7-member regional committee across the country. So if you multiply by 16, that's the number you'll get. And then we're going to have 20 district level advocacy committees. That is what the budget will allow us to do. If we could, we'll scale it up to more. But for now, that is what we can do. So after this one, we will have the district level advocacy committees, and then we'll be doing capacity building for them as well. Objective number 3. To undertake quarterly advocacy and monitoring activities using community-led monitoring tools by March 2024. And this is something that you, the regional advocacy committees and the district level advocacy committees are going to be doing. So the purpose of this is to help to identify first of all, and then address all issues of human rights, discrimination, barriers to access of service, and all that surrounding TB. This is what this objective is going to be achieving. And then number 4, the last one, to participate and engage in TB advocacy and accountability initiatives at national, regional, and global levels. So this grant is also coming to support if, for example, if there's an advocacy program or something in Ethiopia or Zimbabwe that will help us to achieve the other objectives. And maybe if Iman has to take plane and go, this is why that objective is there. Please, do you understand? So if there's a national level activity, maybe NTP is having something here, or there's a regional level activity that you can be part of, this is why that objective is there. Is it clear so far?
Sure.
Alright, so these are the objectives of the Civil Society Round 11 project being implemented by Stop TB Partnership Ghana. Alright, so moving on. Now to the project activities. So we have inception meeting with the NTP staff, which we have done, because you know NTP is the biggest player of TB in the country, so you can't do anything surrounding TB without them. We had a needs assessment. The purpose of this needs assessment was to understand the gray areas, or where at the community level there are issues surrounding TB, so we can focus more of our energies there. Is it clear so far, please? There will be a question and answering time. So stakeholder meeting and project launch. So we engage all our stakeholders, TB Voice Network, Coalition of NGOs in Health, NTP, and all other projects to help us validate in that meeting we validated the needs assessment, and then they also gave us the input that they have towards making the project more efficient and effective at the end of it. And then the establishment of 60 regional advocacy committees, which we have done, and which capacity building we are doing right now. Establishment of 20 district level community TV advocacy and monitoring committees across the 6 regions of Ghana, where IIPs operates within Global Fund. So yes, district level TV, that one is also yet to be done. So this is the activity number 5. Now activity number 6. Conduct advocacy capacity training workshops, which we are doing right now for regional, and then there's also that for the district, activity number 7. And then number 8, quarterly regional community-led advocacy and monitoring meetings. Now, after you have identified issues surrounding TB at the regional level, you need to have a meeting as a committee and address these issues. How are we going to solve this particular problem that Asumesi Anase Obentin is facing? So it's not just going to be the NGOs and the survivors. They are going to have representatives from the regional health directorates on your committee. Most likely the regional health director himself, because they are a key stakeholder of the project, and we just can't proceed to do what we want to do without them. If someone gets the TB1 and they start taking the medication, but then they go off, they don't take the medication for like 2-3 days, and then they come back 1 week, they go off, and then they come back. What you are doing is you are giving them a bacterium time to go to the gym and train. So the next time you introduce that medication, they beat it off. So the MDR is a more complex and higher level combination of drugs that can beat the MDR TB. So we have drug resistant TB, that's drug DR, and then we have MDR, that's multi-drug. So the drug resistant one is when the bacteria is resistant to a particular medication. For example, if you are rifampicin resistant, it means when you take rifampicin alone, it won't work for you, right? But if you are multi-drug resistant, it means that the system is fighting off different types of TB medication, which is a more serious level. That's why I said So that is why the MDR patients take their medication for 9 months. But now WHO has been able to develop a new medication that will shorten the treatment regimen to 6 months. Yeah. That is one of the things that's
for the
multi-drug resistant TB patients. Yes, the regular TB patients are still taking their 6-month medication. So that is it about the DR and then the MDR, and then the drug susceptible TB. That one is the normal one that when you take a medication and you are consistent with it, you'll be fine.
Yes.
All right.
But we even have extra multi-drug resistance. That goes to 11 months of treatment. Yeah. The question will go to that question will go to the committee for you guys to look for local solution. Do you understand?
Yeah.
So there will be a multi-drug resistance. Now the committee discovered that they are not giving the person any support. Meanwhile, the person needs support. You have gathered that data. The question is the money given to the region? Maybe the hospital doesn't even have the money from Accra. So for example, if the hospital doesn't have money from Accra, it's an advocacy. Director then is scanning by, it will end up in his office. Are you getting it? Then he will push it to NTP. Quickly, I do a lot of these ones all the time. It's telephone call. Mr. Futu, please, there is a case in this region. This is the issue. Are you sure? Sometimes the money it has been transferred. It's on the way to hit the account. They are always careful about the multi-drug resistant TB. Are you getting it? If there is a problem with a patient who is not able to take the drug, or committee within the district, then a bit Ghana Health Service, Papa, do you have some surplus budget somewhere with me support? And now you assembly, a friend is saying, young assembly office, district office. Charlie, there is some 1% allocation bill for health, TB, HIV, to do enablers package. Yentimi ma oma omunyina yare TB yare no. Yentimi ma oma duane. Yentimi ma omunyina sika. But obi a ehia no. Any mostly no a multi-drug resistant. Ono global fa saka. Global fa say Ghana ya kan munyina mo kan yeso ye di posisium. Wo mini wo na wo sisium. Say there is budget for multi-drug resistance TB. Enablers package. For the normal TB, if your government thinks, if you people think that your people need it, tell your government to pay for that one.
I kept on asking, since like 5 years ago, as chairman, I kept on asking, enablers package, I've been asking. 2021, I have to mobilize food. I had about 19 patients on TB. We were very far to the health facility. So I had to mobilize food inside West to all those people. But he told me that I was doing that on my own because nobody will help me. You understand? So if truly and truly we want to help the community and society or TB affected patients, then like this committee, we should all come together, have innovation ideas, how we can at least get some foodstuffs. Some are even not getting clothing to wear, surprisingly. So we need to develop that idea so that on our local grounds we can at least get something for them.
When we are driving now, so you saw him alive. He had huge stigma attacking him.
Yeah.
He has the right to medication. He has the right to nutrition.
Yeah.
If there was this committee, you quickly find solution. If you have to move him into a different place, so
We lost about
you
3 or 5
have,
people.
and you would have done a lot of education also in the family to make the family understand the situation. Guys, I have harbored multi-drug resistant TB patient in my house before for 1 month, just to save life in Abeligbe. You have to find a way to do rigorous work to make sure nobody dies under your watch. That is the reason of this project. The right of, if you have to get out, let me tell you something. India, the problem is that we are all not reading. If you are reading the news around TB in the world, and you have become a TB guru, you have answers to everything. When we are meeting the president in Accra, somebody should be meeting the district chief executive. If I meet Nanado now, and we are going to Nanado, we have an engagement of 30 minutes enough. You will ask me, what do you want me to do? So politically, we know you don't have money. But the money runs through the system. If you can give a simple statement, all district chief executives, from now till 2030, 10% of the money that comes will go to TB.
Even 1%.
I don't know if you are getting it.
Yes.
If the president can tell regional ministers, give me regional TB updates every 3 months, you know what that means?
Fellow Ghanaians.
Do you know what that means? Can you imagine how the regional minister will be on the director of health services in the region? TB, you know what he's saying? Because the president can fire you if you don't do the right thing. This is where we are calling for the United Nations high-level meeting. When we secure a global commitment, we use it and come to a national level and drive it. So, at the end of the day, this is how this committee will begin to think and say, then let's expand this committee. So you forget about the money that, if there's money or there's no money. How can we even sustain that committee at that level? Can we bring a chief? Can we bring somebody from the district assembly? Can we bring the district finance officer? Are you getting it? How much are we engaging the medical superintendent? At the end of the day, once problems come, we say defend the rights of that girl, that boy, that man, that is TB. Whatever way you have to marshal the grounds, do it. You see, assuming everything fails, at the regional level, at the district level, let's take it to the region. I am believing that this thing we are starting will become big based on the work you are doing over there. At the end of the day, there should be homegrown opportunities, there should be homegrown innovation, there should be... The only thing we need, guys, the only thing we need from us is documentation. If this thing we are discussing now become a reality at the region, at the district, at the facilities, and we are documenting them, we will have enough evidence to reshape the business of TB in Ghana. And the idea is that if we can document this thing 1 year, some serious documentation, that with support from some consultant, we can present this documentation professionally and produce it at the validation meeting at the regional levels. And then it is consolidated into national data. Do you know what that means to me if I'm defending money for TB in CCM? That's a lot. You understand? Because anything you are talking about, where is the evidence?
Yes.
If you bring evidence, we'll put it in. And when they ask any question, you read the document. And there's a whole document talking about community system strengthening. We are talking about community-led monitoring. That the NGOs, the persons that survive TB and the government together, the district, the regional health director is aware, the district health director is aware, everybody understands the challenges that people are facing. Most of the district health directors, they don't know. They don't know the problem the patient is going through.
Yeah.
He's also busy taking care of how to pay the next salary.
Unless there's strong, evidence to support that this is the rate of infection, the mortality rate of TB in the district, and no district where it's sought will, throw away that evidence.
Yeah.
So the documentation is very key, so that at least you can develop a kind of story. So that when you are telling the story, you know what you are saying, and it will compel duty bearer to buy into it and make policy decisions that will address those challenges.
That's what I'm talking about. If we don't document, forget it. There's nothing. Whoever, doctor, any professor can become chairman of partnership. Any professor can become executive director or secretary. He can't do anything. He needs documents. In the midst of the fact that I can stand and talk in any forum in the world, you should have an evidence to prove what you are talking about. That is when your confidence level is high.
And the ventilation in the environment is very poor. Now, the science is also telling us that most people already have the TB bacilli, but their immune system is keeping it at bay. So you find out that people who have malnourishment or have underlying health challenges, you see the bacilli acting up or activated in them once the immune system is not up to standard. So that is it for and then for key for the prevention, people who are more likely to have the disease are given what we call TB preventive therapy. So people who are HIV positive, people who have people who abuse sorry for that word. People who are smoking addicts, when you smoke, it damages your lungs, so you are more likely to have people who excessively take in alcohol. These are all key populations of TB. So such people, we give them what we call the TB preventive therapy so that the disease does not manifest itself. All right, so I think in order to prevent and control TB, you need to have highly ventilated areas. Or when you are harboring someone who is under medication in your house, keep the place ventilated. And another thing is that after some time, I think just like you mentioned, after 3 months, the science is telling us after 3 months of medication, when you go and do the test, it will come back negative. While it is now, what that means is that it is now undetectable. So, by the fact that it's undetectable does not mean that it is gone. It is still there, just that you are back to normal. But then you still need to take your medication for the prescribed period for it to completely leave your system. Is it clear now? Okay, so we've come to the end of this presentation.
Children have TB. Men have TB. Women have TB. So we are looking at how to ensure no matter gender that is referring to human beings in whatever form or shape, whether you are L, you are G, or you are B, or you are T, or you are Q, or you are QL. All of us have rights as far as TB is concerned. Move to the next one. This is what the content is. Why community right gender in tuberculosis? What is all this nonsense of right again? HIV 4 years right, TB suicide second right.
Malaria to
What Global Fund institution are saying about the need for CRG. So that community right agenda on one hand, CRG. What is the global institution saying? The whole world, what is it saying? What is Turkey Partnership Geneva saying? What communities have to say about the need for CRG to end TB? Millions of people are dying of TB. Millions of people are affected. The rationale of this whole CRG is said we need to support services. See, anything that make people lack access to services. We don't want it. We want to support. We want to support the services so that human rights violation will cease, stigma will cease, amount to so that we can save vulnerable populations and keep populations. Very simple. This whole project about take it or leave it. How can we save lives? So it's a life-saving restructuring we are doing.
Millions of people year in, year out are not realizing their rights to health, and as such, governments are not fulfilling their obligations.
Yes. How can we make sure say people know their right? When people begin to demand their right, the duty bearers will begin to act, and the president will begin to act.
The way like we implemented our previous program.
And yes, go ahead.
How we implemented our previous program also in the general public didn't make their rights. How you do it? You're only interested in peaceful, but you don't do the public education as well. And the public education, that's how to do something like let the public know their rights. Even if I think I sit down and it's not for me, I can go to the hospital and say, all this information.
So you see, why are we not doing it? We as NGOs, are we serious? If you are an NGO, are you serious?
Yes.
You understand? If you are serious, you will realize that one opportunity for you is enough for you to do many things to attract other opportunities. They say that, look, you know my district. See, I always use myself because me, I've crossed all those barriers. You understand? I sit in Accra and I'm on radio in my place. They want to talk about this, so call Mr. Fred. They want to call Mr. Fred. And now I have started building volunteers who go on radio to talk. Community information centers, my people go. Connect with the people and do what you can do and sell your NGO. TB has given you money. You have 10,000 Ghana cedis to do case filing. What stops you from engaging a DEBA? If indeed you have a very good relationship, how many times will you go on radio? I went to Lolono once and I paid. The way the program went, they needed me as a resource person there. I don't know if you are getting it. What capacity are you carrying? With your capacity. You see, at the end of the day, everything we are doing, it must center on people. When we are planning the programs and we are not looking at the human beings that are TB, it is wrong. So communities' right agenda is saying that at every point in time, whatever it is that we are planning around TB, the focus must go to the human being. If you are not thinking about the human being and their right to live, their right to treatment, their right to survival, no, there is a wrong plan. That is what CRD is talking about. If somebody, the drugs are there and somebody is still dying because the person couldn't get food to eat, it's a problem. Bringing people to implement and to design. District level, that's a regional level, the person that assign already, because we are firing Muda. Say David Tale Tama, the enemy will say, Nanayo, and Madena Munju say, Yarena Kasa. And then Nippon Nakasa, Yarena Nakasa, because Unyanya Yarena. What are you? To Kasa Yarena Kasa. We are in room Muda Untiasia. Global CRD commitment. Global level. These are commitments at the global level, and we are talking about When you say global level, we are talking about donors, we are talking about countries, MPs, we are talking about development partners and countries, especially the big countries. Because they push down the money to Nanando and his peers. So they have strong coalition with civil society, see, for the protection of human rights. And it's patient centered. These are the commitments. If you read the UN high-level declaration, the one we went to New York to secure, that document, the overall, you will see these things. That is a commitment. They are committed to ensuring civil society. So if you see compared in my main speech, you listen and you said, with deepened civil society what? Involvement. So please look at this document. There is a document called NTB strategy. Go and read. Look for it. Emmanuel, you will be sharing with them. And then we have global plan to NTB. They all have this commitment. Then we have the global fund strategy. We don't read. We don't read. So the regional, you go and have a meeting. The first meeting, you want to see the data. You want data. What is the situation of TB in your region? It must be. Don't let somebody say it. Let him share it. So you have it. So that when you are on radio and you are talking, you say, listen to me. The most affected TB community district in this region is this. Followed by this. Followed by that. Then when they get the information get more interesting, you begin to give them the details of figures. And then they begin to be seriously. Plus, go to Google something partnership and watch some of the interviews we do on Joy News and the rest. We hit it so hard that the journalists now he can't talk than to talk for us. It's the same way we're able to mobilize Parliament to agree to form TB caucus. It's not easy. Because they ask you questions. And you are speaking with the evidence. The one document, you give it to them. Is somebody's capacity being built?
Yes. The purpose of the One Impact app is to support or help users. Now, when I say users, what I mean is persons living with and affected by TB, NGOs, Stop TB NGOs, TB Voice champions, and even healthcare workers. All these people are users of this app. Now, it is a platform where if someone is facing a challenge with TB services, they are able to make it known on this app. And then the duty bearers the advocacy will make the duty bearers to take that issue up. So, HMFD piloted it last year, and then in our application, we mentioned that we are going to partner with them to be using the One Impact app. So it is a key, and then even Stop TB is saying that, Stop TB Partnership Ghana, make sure your regional advocacy committees and your district advocacy committees are using this app. So this one, we don't have a choice, whether we like it or yes. We all need to understand what this app is about, download it, and use it as a key tool in our advocacy initiatives. Is it clear so far?
Yeah.
Which? Are you seeing that? Alright. So now under the please choose your, I think it's automatically set to English, right?
Yeah.
So you leave it as you leave that one as it is, and then you select I agree to the terms of service. And then you also select I agree to the privacy policy. Have you done that?
Sure.
Alright. Now click on the button Get Started. So the first thing you should see, get to know your rights, access information on tuberculosis. So one thing that the app does is to give you as much information as possible about the TB disease. So if there is something about TB that you would like to know, or if you just click on, okay, let's move ahead. We'll get there. There are so many components that.
Should we skip or go to next?
Okay. So please click on skip. When you click on skip, the next thing that you will see is let's have a username. Person with a disability, ethnic minority stroke indigenous person, and then we have other. So if you identify as any of these people, you can take it. Now the reason the app is asking you is because those are the back end. This will help them to give you the best response possible because they know the category that you belong to. That is why the app is asking you all these questions. Depending on the responses you give, it will let them, those at the back end of the app, know the kind of person you are. So when they are communicating back, they know how to go about it.
You know, I think we can choose a healthcare.
Yes, you can choose a healthcare worker. Yes, you can. When I click on get information, I have TB basics, right? I also have updates or the latest news from Stop TB Partnership. So this app refreshes itself in the background. Whenever Stop TB Partnership posts some new information, you can access it here. I also have gallery, and then I have videos. So if there are any videos that any of us have done, when the team uploads them into the app, you'll be able to see it here. That is under get information. Now you will see that under get information, when you look at the top, there are two tabs. There is medical experts, and then there's people affected by TB. So over here, when you tap on people affected by TB, you see some testimonies, some pictures of like cure success stories, and stuff, all stuff like that. You want your fellow colleagues on the platform to know about. You can raise it there, and then other people, once they get a notification, they'll respond to it. So I am typing there. Regional TB advocates. Okay. So if you send anything onto the platform, your name will appear, your avatar will also appear, and then the message that you just typed will also appear. So if someone else sees it and they want to respond to it, or they're interested in what you are saying, they will give a direct response to what you just posted. I'll go to human rights violations. So let's all click on human rights violations. So it's kind of a survey that the form will ask you to fill. But please don't fill it just yet. So we have confidentiality under the human rights violation. There are a number of options. We have confidentiality breaches in health facilities. We have confidentiality breaches due to how TB services are delivered. We have discrimination and unequal treatment by healthcare providers. Discrimination and unequal treatment in society for you to use in your work as regional advocacy committee members. So please do your best to go into the app. If someone asks the question, the app will give you a notification if someone posts something on the forum.
The outline of this presentation is here. You can see it. Look at the goals of the committee, the routine activities you are likely to engage in, which don't have money, but we are hoping you will find a way to do it. Composition of the committee, duties and responsibilities. A TB caucus, call it TB committee. In Parliament, we went to form it. So now we have MPs that want to talk about TB for us in that committee. We also have some regional level, district level, and so Ghana Health Service operates, of course, an integrated decentralized health service system. Is that not it? And that happens at the district and sub-district and community level. Typically, we have the national hospital, we have the regional hospitals, but you find operational health service delivery at the district level, at chief compound level, sub-district level. So we have the chief zones and the chief compounds. We are looking at community-based services which are provided to the community-based health planning and services. It's simple. That is how I was mentioning chief zones, chief compound. It's the same thing. Go down. I don't want to continue the background, but we know that for us to have effective and close monitoring of operations of various implementing partners working closely with these countries, there's a need for us to do certain things. So we are talking about chief compounds working, we are talking about government itself working, NGOs working, we are all looking for TB cases, trying to put people on treatment and all of that. If we want to make sure that everybody who is working, things are effective. Things are effective to the extent that the right of people are not being trampled upon. The right to have education, the right to have treatment, the right to have the enablers package, the right to have cure. In order that we do this, we need the decentralized advocacy monitoring systems. So what we are forming is a monitoring system, and I'm what? So this committee is not just meant for, it's not only a civil society committee, it will have other government, but at the end of the day, we are looking at how we can mobilize stakeholders to improve service delivery, do advocacy for resources as well. And you can imagine, you can see all the discussion we're talking about, the challenges that we are likely to face. It's all about, can you get this person involved? Can you get that person involved? How can we get some resources to solve the problem? So it's all about resource mobilization, advocacy, improvement of service delivery, which is supposed to have the person with TB in mind. We are driving advocacy at the regional level, using community right agenda tools. Does it not make sense? I've already spoken about community right agenda. You see, when we say community right agenda tools, people think that it is a form like this that you have to fill. People think that it is some physical tool being here in your hospital that be. Tools are documents. For example, United Nations high-level meeting now. That document that Ghana and all nations have gone to pen their signature is a tool. When you are in a discussion on review and a politician look and say, Congress not doing well, then one politician wants to put you back. Since one respect, then we will refer him to the document and say, that man, you call United Nations concern. Yeah. When then start it. I never said you lie. This is a video. It's a tool to use. So anything that has to do with communities, documentation on the right of people, it's a patient right. Emmanuel said, you what? You ask them to read, take time and read the rights of
Yes.
share that up. To strengthen the capacity and involvement of CSOs and TB survivors in the national TB response. I hope that also makes sense. It comes back to involvement of TB survivors. To strengthen the capacity and involvement of CSO and TB survivors. So we, civil society, NGOs, joining hands with the civil survivors and government. But this, the objective is, see, the principal business of TB is for government. It's the health directors who are supposed to do their work. But because they are not doing it as expected, that's why we are coming in to support. And so the project is looking at strengthening you. So what we are doing now, we are strengthening you. And then the TB survivor. So we can be part of the national response. The epidemic, progress made in national TB response, and challenges in the achievement of national and global TB targets. So you become this committee. How can you share updates? You see, when you have information, how can you use this information to inform the communities, inform disease assembly, inform, like the way The moment this committee starts, the committee chairman can write a letter. Design a nice, design a nice letterhead. Then the committee chairman writes to the district chief executive of your district, or the regional director of health, or the regional minister, and attach the speech, but ensure that service delivery to all patients is ongoing. You see. So at the regional level, how can you begin to gather information from the district? Are you getting it? So the information will be coming from, for example, the committee want to meet with the TB focal person in the region. So you have a meeting. It can be a virtual meeting like this. So a regional TB coordinator, Ashanti region, we want to know how many people are on treatment in Ashanti region now. How many people have been diagnosed? You want to know whether he knows of any problem that is existing. What are the stock levels of drugs in the various in the medical stock? You want to check. You have to think and engage. Raise up your hand if you are sleeping. I said people who are sleeping, you raise up their hand, you are laughing at me. Oh, you know first. And then we are looking at to strengthen partnership and collaboration with stakeholders. Are you getting it? Community meetings which will be facilitated by the secretary of the committee. So you meet online, physical, depending on what is physical. Even the board of the resorting partnership, we don't meet physically. The last year we never met physically. It's always online. And if you want to pay TNT, you pay through Momo. The contact with the record is done. So a lot of things can be done without necessarily wasting time to wake up and dress and go to. But some of them you have to go. How are you? The question is, if you at your level say, how can we get this thing done? Accountability meetings. What are we calling accountability on? Even though we're supporting from the national, at your level, what should we check? What should we check? What should we check? Drugs, gene experts, sputum containers, cartridges, the evidence package for whatever you want to be. You want to make sure there's no shortage. The regional committee shall appoint the chair and the secretary. So you say that when you go to your meetings, you appoint the chair. We prefer that a woman is a chair. We prefer that a woman is a chair. But when that is not possible, it's no problem. I hope you understand. Why? Why I mean? Who said why on which one?
Why woman?
Gender. 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 You see that in this room only 2 women have come. At least you should have quarterly meeting. If not at all. Me, I don't expect it to be quarterly, but see, you mentioned quarterly because we are assuming that for the quarterly meetings, you should be able to pay for your meeting. The project should be able to pay for your meeting.
So I have a challenge with that. The project is ending March 2024. And it's starting next in November. So how visible is this place?
So this is a committee that is supposed to remain forever. That the project has ended doesn't mean that you and I are ending this way. When you say a sustainable committee here means that we are going to do everything possible to make sure the committee is working. And so we must mobilize resources even at the regional level to sustain ourselves. At the national level, we'll do everything we can do to make sure there is some resources made available. Now, this is challenge facility round 11. We have also won around 12, so it is proceeding to the end of next year. So the round 12 is coming to support this one, to continue working. I'll be deemed sufficient to form a group. Okay. Go down. Okay, so this is what the 7 is supposed to be. But the 4, you see, this is 7, isn't it?
Yeah.
Ghana Health Service 1. How do you get a Ghana Health Services? There will be a letter from the NTP from our office to NTP. NTP will push it to Director of Public Health. Director of Public Health will send it to Director General of Ghana Health Service. Director General will write to the regions. The regions. The regions will be the one to write to the district. Are you getting it? The regions will write to the district. So these terms of reference will all be known to the Director General and the NTP. So you will now go to have a meeting with the Regional Health Director, let him understand what this committee is about, and then he will, in addition to the letter that is coming from the Director General, he will now nominate who should be on the committee. I mean, Papa, we just need to talk to him. Emergency. Oh, you'll be fresh. Oh, okay. Then say, oh, Charlie, test now we are no result now by your home team. I am positive. What do you do? Are you getting it? And can you imagine that thing happen and you document it? Somebody say, okay, these are my job. The reason I'm standing here is so. Next one. Compile reports on all meetings, findings, and a big report, things that matter. So we need to develop a lot of tools to help note these things so that they can be shared. Contribute feedback that will fit into the discussions of top-tier partnership at the national level. You see, so when your report, your issues, your report, it's up to the committee to decide, say, hey, Charlie, these things, we need to let the national have this information. We push it. At the end of the day, we have a whole structure that's mumbling and bubbling from the bottom to the up. So that when the national chairman, the national advocacy committee chair, or board members are talking, they are making reference to our committee at the region here says this, and then when I am on, or the chairman is on GTV or TV3, he said greetings to Mr. Ban. You understand? Our ego blah blah blah, madam, so and so, and then we are enjoying. Also called you so our chair health director no, and our regional minister no, for the good work you are doing, praise them. But now I said problem be until they should know that this challenge is coming. Everybody should be happy. The regional minister, I salute you. We need your support to be able to deal with this case. The committee, at least at each first meeting, will put together a work plan, a meeting schedule, and then facilitate arrangement for your work. The secretariat will help you to see, say, if you are not, whatever small money that can come to your work. First meeting. It's a guide. Ensure close monitoring of the activities of the partners, transparency of process, and prompt response to TB issues. Okay. The NGOs that are working in that region also can be. How is your work going? This committee, like I said, will report on what's our meeting. Have you? Because if the NGO doesn't do their work well, quickly, and bring more money, there are people who will not get cured. Somebody's life depends on the small money that we release from Accra to you. That your volunteers may be going around and they will find you. If those volunteers don't find you, they might die. So the delay on the part of anybody and everybody is a problem to life. In there, like I said, Global Fund has not released money to Chad. Short 2-3. Some 40 people have died of TB already today. Because in the last 3 months, the NGO was not working because of this car. The director, health person, DHMT, the chiefs, the media people, please remember to say thank you to people.
I like that.
You see, you want to meet the health director, he has given you a welcoming way. Director, I just said so now, the way I buy out here, AFS, yeah, that was keep thanking people until everybody become happy working with you.